Hey Bob, how are you?
Doing well, thanks. Good morning.
Good morning. I just wanted to thank you for joining us today and maintaining this. I know that we had a little technology difficulties kind of just getting rolling.
Got it?
I want to jump right in. Really just kind of we'll spend about 25 minutes or so kind of talking about your business, learning more about, how you started, what your mission is, because the way I kind of view your business, right? It almost felt like the more I reflected on it and the longer I spent thinking about your company and what you do, it didn't feel as much about like a business as it felt like a mission. Like,
Correct.
right?
Right.
So why don't you jump in? Bob, thank you so much for being a guest on the Think Small podcast. Tell us about your company.
Great. Thanks, Alex, for having me. I appreciate it. So I grew up in the transportation space, family of professional truck drivers. I drove when I was very young, long enough to realize that's not what I wanted to do with my life career. So I spent my life in the health, wellness, healthcare industry. But I was always attracted back to this because I have two brothers that still drive today, in their close to late 60s. Our father actually was really the motivator to get me into what I do today, is because he retired after almost 50 years, and he retired with the professional truck driver healthcare package. He had high blood pressure, sleep apnea, diabetic, and it cut his life short. So I, with my health background and health and wellness and fitness and working around healthcare, I recognized that there was a real need to try and develop some services and products for these men and women out there today, because everything you have around you, Alex, came from a truck, right? They got delivered by a truck, and they're a very underserved population. So you're correct. This is really more of a movement for me, a mission to try and help these men and women out there today learn how to make small changes, because they're just not educated to do that, right? They're trained to drive the truck between the white lines and back up, forward, those kind of things, but not how to make healthy choices when you're on the road. It's a tough challenge out there, as if you've ever traveled across country or even in town, right? So so that's what I spent my time doing. What I enjoy most about it is that, opposed to working with people, what I refer to in the private sector, like in gyms and that type of thing, if they don't look like everybody in the magazines in 30 days, they quit, right? But professional drivers, their livelihood depends on their medical card, and a lot of people don't realize that they have to pass a physical. They can get a physical that lasts 2 years. But unfortunately, out of the 4 million drivers we have out there today, almost 60% of them operate on anywhere from a 3-month and a 1-year card, because they can't pass their physical because they either have high blood pressure, sleep apnea, diabetic, pre-diabetic, those kind of things. So there's a huge need to help these men and women, because safety is key in professional driving, and you can't be safe if you're not well. People like you and I, we can get up today and maybe not feel really good and have a cold, flu, or whatever, and muddle through the day if we need to work. But when you're a professional driver managing one of those, big piece of equipment down the highway, you got to be at your best every day.
Yeah. One of the things that you said was when you're traveling across country, if you're trying to find a bite to eat, that's one of the hardest things, right? And I know exactly what you mean. I've got two little ones, 2 under 4, and we avoid fast food at all costs. And it's not just for the health reasons, but also for the sugar reasons, right? Like, there's so much sugar in that food. So try and strap 2 kids back into their car seats for a long trip across the state or whatever. It's impossible, especially after fast food. What do you recommend when you have somebody that, how do you manage that when you're in this sort of food desert, right? And like the only option is McDonald's or a gas station.
Yeah. Well, number one, what I always try to do to educate drivers, is, try to, pre-pack. Most all the equipment today, are set up with refrigerators. And so, I always try to encourage drivers that, the weekend before they go out, prepare, pack you some snacks, because when you're a driver, in the life and day of a driver, you're going to get stuck. Could either be in traffic, bad weather, or whatever, and your construction slowdowns. And when you're sitting there, if you don't have a good choice to reach for, you're going to make a bad choice. And so that's why it's very important to keep your truck stocked with some healthier snacks that you can reach for, that will keep you from temptation. And one of the biggest temptations, of course, is over smoking and slamming down power drinks, which, can be very dangerous for drivers as well. But, other than that, that when you do stop, then most of the travel centers, I would say today, do a pretty good job of having some healthy alternatives. But the problem is that you got to really be disciplined to go in and look for, right? Because what they do is, one of the things that also people don't realize, that the truck stops, they are really, their largest percentage of consumers are four-wheelers. And so, when you look at the rest of the population out there, it's just not drivers that are obese. I mean, the big population of the United States is obese, right? And so, because those folks go in, and when they walk in there, they're looking for the hot dogs, they smell the cinnamon buns and all those things, the donuts, and those people, that's what they want. So that's what they cater to, right? So the driver comes in, been on the road all day long. They're tired. They've been away from their family, and they feel like they're deserving. They've been deprived, right? And they smell that kind of food they look at, and they get tempted, and they indulge themselves in it. And when I do radio shows on Road Dog Radio, satellite trucking show, the number one question I get from drivers, and they call in and say, "Bob, when are you going to get these truck stops to stop serving that crap?" And I said, "Well, here's the first tip, my friend. You got to stop buying it, because as long as you keep buying it, they're going to keep serving it up to your friends. So next time you go in there and they got 3 Kit Kats for $1, tell them you want 3 bananas for $1 or whatever. You gotta tell them." But that's just the nature of it. That I've been working with, for example, this one healthcare company I've been working with, and so they're wanting to break into the space to help educate drivers and companies and so forth. So they went to a couple of the websites of the truck stops and opened it up. What's the first thing they see? Big exercise, Coke, double cheeseburger, slice of pizza, that kind of stuff. So, but that's just, what people buy, and that's what they're going to serve them, because they're in the business of making money.
Right. And I mean, every once in a while is okay, but when it's breakfast, lunch, and dinner, that's when you get a real problem, right?
Yeah, and you do. It's moderation. I tell them all the time when I'm coaching them, just give me 50%, right? 50% of the time, make a better choice.
Yeah, that's huge. And you'll see a tremendous amount of results from just conscious decisions when it comes to what you're eating, right? I'm in the employee benefit space, and every time we get on a call, monthly, we hear rising healthcare costs, and the principal driver almost always inevitably comes back to GLP-1s. Over the last 2 years, it's like skyrocketed in the amount of high RX claims, right? And those GLP-1s are exceptionally expensive, so it's really what's driving the cost up of healthcare. And it's just people that are looking for lack of a better phrase, really a shortcut into losing some weight, right? But there's alternatives out there, right? There's healthier diets. Talk to us about like activity level. How do you manage that? Like, do you set them up with a program? Do you coach them? Do you set them up with personal trainers, physical therapists? How does that work?
Yeah, thank you. Good question. And you're right about the GLP-1s. I mean, it really, of course, when all the compounding pharmacies came out with that, right? I mean, you look at, gosh, you can go on GNC's website, you could get it, or you go into Weight Watchers, everybody, it's because everybody wants basically to take the pill, right?
Right.
And with the easy way out. And so, but for drivers, and when it comes to exercise, the first thing I really always recommend, of course, they got to watch what they put in their mouth. There's no magic, token about that. But it's really, I worked with a large manufacturer, Freightliner trucks, and we designed an in-cab gym system, a band system that can hook to the back of the sleeper, so drivers can get, and it's effective enough. It's just about movement, right?
Mm-hmm.
And just simple things about, when these drivers that most of out there, they're 300 plus pounds, and the fact of getting them to do some kind of serious movement workout is very difficult. So, so you got to start with the basics first, get them motivated about losing a few pounds. And once they lose 10 pounds or so, they start to feel a difference. And then doing simple things like, the walking and using bands to exercise with are very simple. And you can do it in 15 minutes and can be very effective. But, you mentioned something to Alex about, I've been in hundreds of these meetings with HR people, and they got the benefit provider there, and they got the insurance company there, and they're all going around the table. You got to do something about these rates. Well, you guys do something about hiring all these unhealthy people, right? But until somebody wants to really step up and really help change it, and I've had many conversations with people like USI, yourself, and others, and that's the reason I came out of this one particular tool. It's very cost effective. It's called a CDL health scanner. It's a new technology. The driver can download it one time, put it on their camera, on their phone, and they use their cell phone camera, hold it in front of their face, and in 30 seconds, it'll do their blood pressure, their heart rate, their BMI, and their respiratory reading. And then it gives them a reading and just allows them to kind of, as I say, take a peek out of their personal hood and see what's going on and see if they're in line before they go take their physical and potentially, get disqualified because they can't pass. So, the format really is about why not, prevent and take care of the driver today before you hire the next unknown driver tomorrow. And not knowing, again, as you know from being in the space you're in, there's such a high turnover this driver. I mean, some of these companies like 90% turnover. They keep they bring them in. And I mean, I can't tell you how many of those recruiters I spoke with too. And I said, how many drivers you bring through this month? 50. How many end up staying? 5. I mean, just insane numbers. And it's like they spend thousands and thousands of dollars on technology that can tell the shop foreman, hey, listen, Mr. Shop Foreman, you got 5 trucks out here that got X amount of miles on them. If you don't get them in the next 100,000 miles, they're probably going to blow up on the highway. You can't spend $100 to get a driver to do a screening, to see where their liability is. Because at the end of the day, it comes back to, covering safety.
Yeah, absolutely. When I think about wellness and I think about health in general, I think about it almost in 3 prongs, right? I think about diet, right? Diet, nutrition. I think about physical activity, and then I also think about the mental health side of it. And I have to imagine that goes hand in hand as well. I've seen a lot of studies that show that one of the most powerful anti-anxiety, anti-depression medicines out there is physical activity, right? So do you primarily deal in any of that in the mental health space as well? Like,
absolutely.
Yeah,
absolutely. That the whole mental health, that, the access to mental health was always buried in the back of the employee manual, right? It's like they did it because they had to have some kind of coverage, but nobody ever talked about it, right? Well, of course, over the years since COVID and all that, as you know, it's become very, very, very mainstream, more so now. Don't feel bad about calling them, saying, hey, we all need to at some point in time.
I think there was a big effort to remove the stigma around it, and it's overall a benefit towards the overall mental health of our workforce.
Especially when you're a professional driver, you're out there alone. One of the other programs I'm involved in is 22 by 22. We have an average of 22 veteran suicides a day out there. So every November, I do what's called Keep Pushing. From November 1st to November 22nd, it goes out all over the country, and I get people all over the world participating. Doing 22 push-ups a day for 22 days to raise awareness, to raise money, so that these men and women, when they're out there, because 10% of our driving workforce out there, CDL drivers, are veterans. And I hear it all the time. They're out there and they're on the road alone, and they're driving down the highway, and all of a sudden, they start thinking about stuff, and they need somebody to talk to. And it's very, very important so they can have access to pick up the phone and just have a conversation. Yeah,
absolutely. All right. So we've talked a little bit about how the sort of end user experience, right? Like how the truck driver, benefits from your service, right? from the employer perspective, how are you approaching employers? How are you getting in touch with people to implement sort of this wellness package or this wellness program that you have?
Well, one way is we have about probably, I don't know, 6,000 drivers now using this application, for example. And I work with a company called Enrollment First out of Tennessee. They've been around for 20-some years. They're the largest provider of health benefits. You know, in your population, you have company drivers, then you have contractors, right? And of course, contractors can't take advantage of the company benefits, right? They can't cross the line. So they supply those contract drivers if they need to get medical care, need to get 401ks, life insurance, all those kind of things. They make that available. And when they get that package, they automatically get my health scanner and they get a wellness program with it when they get their package. And now for other companies, because the cost point on mine is so relatively low, it's $1 a driver a month. It's $12 for the whole year for the driver to have access to this tool. And when they use the tool, when they go from each page and if their blood pressure's raised at the end, and when they go through and take their readings, it gives them links and suggestions. If you want to talk to somebody about it, you want to talk to a coach, you want to talk to a sleep expert, whatever, right? They can then take that on and get some advice. But this is it's a very cost-effective and scalable way for a company to get a program started for their drivers, and they can use for their employees too. So I'm having conversations with a lot of insurance providers today, like yourself, that when they go in and I know your business that space is very competitive, and it's always about the price point, right? And so this is a price point that they can pretty much, as they use the term, bake in and make part of their product offering, because it doesn't change the price that much, but yet it's a huge benefit. It's a way for insurance companies to go back and say, hey, listen, we've got a product here that we're going to make available for you. It's part of the insurance product and coverage. And it's a way to raise awareness for your drivers to take action, and for you, because, like I said, we lose so I have a podcast that I do every month called Fit Drivers Podcast. And I have, for the first year I did it, I had on people from the CDC, FMCSA, doctors, everybody that does these exams, Virginia Tech Institute that does the research for FMCSA on drivers and drivers' health, and talk about this and how critical the numbers are. So now what I've been doing, having people on that offer solutions and telling stories of how they've helped these men and women make changes. And we lose 300,000 drivers a year that get disqualified. So when you hear all the rumblings, about that there's a driver shortage, there's really not a driver shortage as much as a shortage of vision to do things differently. And that's put a program into effect. And even if you take that 300,000, Alex, and say, 150 of them, 1,000 of them have some type of a serious health issue we don't really have any control over, they really need to be DQ'd out. And you take the rest of them by making simple changes. I mean, you think if you yourself, as a consumer, you went to see your doctor and the doctor says, hey, listen, you got 90 days to make a change, or I'm going to have to, take your license, that's a pretty scary feeling for these drivers. And when they have to go out there every day and you worry about getting from point A to point B and deliver, and they're thinking about that, and they're thinking about the pressure, taking care of their family, it's pretty tough, extra pressure, because then it mounts up and it makes it difficult to make a change.
Yeah, a lot of interesting thoughts there. Bob, it sounds like you've got a lot of different offerings, a lot of different options for you. I'm wondering, I always like to wrap these up by asking, how can people get in touch with you?
They can reach out to me. My cell phone is 602-692-2734. They can email me at bob@fitdrivers.com. They can go to the website, fitdrivers.com, as well. But, email me is, or text is one of the fastest ways. And, every day I get calls either from drivers or companies, right? They get tired of, and generally what happens, unfortunately, especially the small fleets, maybe 200 drivers here, because those drivers are more like family. They're not a number to those men and women, right? And they've got a driver who's been with them for a number of years, and they found them unfortunately passed away in their truck, heart attack, that kind of thing. And they want to do something different to help these men and women. So it's like human nature, right? You wait till the big bad news comes, and now everybody's ready to make a change.
Yeah. The other way I kind of like to wrap these up is just that by, I always like to leave them on sort of a high note. So tell me something optimistic about trucking, or how you feel about the near future, right? What can somebody do today to have a better tomorrow?
Well, one thing is actually I'm just finished up a podcast and just posted up there. Worked with a company that had a driver that his heart specialist told him, says, "You got to do something. You're going to die." And this driver went in and through coaching, and he changed his habits. And he said, this is something that's really, very real. He used these own words. I didn't put it up there. He used it. He goes, "I refuse to be healthed out of my occupation." So I took it on and quit smoking, lost weight, did all those things, and kept his medical card. He's still driving today and taking care of his family. So it can work and can be done. But for companies, I tell them all the time, I don't know what the right program is for you, but I do know the wrong one is do nothing at all.
Yeah.
So take that first step.
Bob, thank you so much for joining us today on the podcast. It's been an absolute pleasure.
My pleasure. Thanks for having me. I appreciate it.
All right, so we'll cut here, but that was great. Thank you, Bob. That was the background looks great. You look awesome. Thank you.
Thanks.
This was really, really a pleasure. I think it flowed perfectly, like no notes. It was like very smooth.
Great. Well, I appreciate it. So I do these quite often, and I'm very, I just, spend a lot of time in this space and understand it. Had a lot of conversations with the USI. In fact, USI, I worked with them several years ago. They had a couple of their clients up in Northeast. And so, but I have a product going now, working with Hub on some products as well. So I just try to get more companies like, USI and some of those to get behind us and help address it. And because, you're in front of it every day.
Yeah. I mean, you'd definitely be on my mind next, trucking transportation company that I end up meeting with. So, but thank you again.
All right, man. You're very kind. Appreciate it, buddy.
Take care.
Bye-bye. Bye-bye.
Bye.